Hello and welcome back to our YouTube channel called the Rheumatologist. So today we will discuss about the side effect of use of steroids in rheumatology or any disease, for example. So most of the side effects of steroids occur at a dose of more than 7.5 to 10 mg per day. So more than that, usually the side effects of glucocorticoids start. Usually at doses of less than 5 or 7.5 mg per day, we don't observe much of the side effects as such. Okay, so we'll discuss what are the common side effects that we see in our daily clinical practice. So basically steroid side effects can occur in any organ of your body. Okay, so in your skin, for example, you can have something called thinning of the skin. Okay, then you can have few bleeding spots on the skin, which is called as ecchymosis. Then you can develop striae, which are purplish lines which you develop usually over the trunk or in the abdomen. Then patient can have significant weight gain with use of steroids at a dose of usually more than 10 or 15 mg per day. If patient is using for a long time, then they can develop weight gain also. Usually less than 7.5 or 10 mg hardly causes any weight gain. So usually more than 10 is when it usually causes significant amount of weight gain. Then it can include your eyes also. So eyes, there can be cataract, there can be glaucoma. Glaucoma is basically increase in the pressure in your eyes. Okay, then high doses of steroids can also cause lot of mood disturbances, sleep disturbances, psychosis. Sometimes suicidal tendencies also can happen with use of high dose of corticosteroids. Okay, then other metabolic side effects that we see are, one I already mentioned, is weight gain. Okay, then it can cause high blood pressure. So monitoring BP is very important in a patient who is taking steroids, especially if the patient is already having a hypertension, okay, or a chronic kidney disease where the BP can tend to fluctuate a lot. Then we have something called steroid induced hyperglycemia or steroid induced diabetes. Okay, because steroids is known to increase gluconeogenesis from the liver, and it can also cause insulin resistance at the periphery. So this will cause your increase in the blood glucose level. So especially if a patient is diabetic, we have to be very careful before using steroids. We have to monitor his blood glucose very strictly. Okay. Then another side effect that patients develop when patient is on steroid is your infections. It can be any infection. It can be your skin infection, your soft tissue infection, it can be your upper respiratory tract, or it can be your lung infection. These are infections that are common in patients who use steroid, especially at doses of more than 10 milligram per day of prednisolone or equivalent to prednisolone 10 mg per day. Okay, so and at dose of more than 20 mg per day, there is a risk of having PCP infection in your lung. PCP is your pneumocystis jirovecii infection in your lungs. That is also known to occur, especially at doses of more than 20. And one very important and interesting fact that you all must understand is the risk of infection with use of steroids is actually higher than with the use of your DMARDs or your biologicals. So this is a very interesting fact. Okay, so don't get confused, okay, or don't get carried away that your doctor is starting a biological or other DMARDs, okay, instead of using steroids. So it is actually a good thing, okay, because the risk of infection with your biological or your DMARDs or your JAK inhibitors is actually lower than using steroids at a dose of more than 10 or 15 mg per day. Okay, then another side effect of steroid is on your bones. Never forget the bones. Okay, so steroid use, especially for more than 3 months at dose of 7.5 mg and above, is known to cause reduction in your bone density, which is called osteoporosis. So if there is osteoporosis, it will naturally put you at an extra risk of developing a fracture because of the bone density is weak because of steroid use. Then another important complication is avascular necrosis of the bone. Basically, with high dose steroids used for a long time, the blood supply to your bone gets completely cut off. Okay, this is called avascular necrosis. Usually it happens commonly at your long bones, especially your femoral head. This is where your avascular necrosis happens. Then it is important to understand that the steroids also have a prothrombotic risk. They can cause blood clots and thrombosis also. So steroids usage at a high dose can put you at a risk of developing premature coronary artery disease and myocardial infarction. You can have a heart attack at a much younger age with use of steroids, unauthorized use for a very long time, or self-administering steroids for a long time, or taking steroids over the counter for a long time. It just because it gives you a feeling of well-being, don't tend to abuse use of steroids more than what it is required to be used for a particular rheumatology condition. Then I get a common question from patients that doctor, can I take vaccine when I am taking steroids? Yes, you can take vaccine when you are taking steroids, but there is a criteria for that. Okay, if at all you are on a steroid dose of more than 20 mg per day of prednisolone equivalent, you must not take vaccine. Especially live vaccines must be avoided when you are taking a steroid dose of more than 20 mg per day of prednisolone equivalent. Okay, less than 20 mg per day, it is still okay to take the vaccine, although efficacy of vaccine may come down a little bit, but 20 mg appears to be the sweet spot below which you can take vaccines, including live vaccines can be taken. Then another common condition where I see is, for example, a patient is pregnant or patient is lactating or breastfeeding the baby. Can she take steroids? The answer is still yes. Okay, but if yes, then what is the dose? What is the duration? Okay, so in a pregnant lady, we usually must avoid any forms of steroid which cross the placenta to the baby. Otherwise, it can cause side effects to the baby. So usually drugs like prednisone or prednisolone are relatively safer to be used in pregnancy, but again the sweet spot is 20 mg per day. Okay, in pregnancy usually we limit the steroid dosing to less than 20 mg per day. Okay, the same thing goes for breastfeeding also. In breastfeeding also, we usually limit the dose of steroids to less than 20 mg per day of prednisolone equivalent. Or in case if the mother requires a higher dosing of steroids when she is lactating, that is breastfeeding the baby, what we tell the mother is, okay, you can take the steroid, but there must be a gap of at least 4 hours between taking the steroid dose and beginning of breastfeeding the baby. So if that gap of 4 hours is maintained, so it shouldn't cause much problem to the baby, and it shouldn't be excreted much in the breast milk also. So again, 20 mg prednisolone equivalent appears to be the sweet spot for your pregnancy as well as your lactating or your breastfeeding mother. So these are the common side effects and myths that we have covered regarding use of steroids and the side effects of various corticosteroids, and what is the safe dose to be used in case patient is planning on vaccination or pregnancy or breastfeeding the child. So stay tuned for more updates on our YouTube channel. So please like and subscribe to our channel.